According to the CDC, more than 480,000 deaths per year only in the US are caused by smoking. More than 41,000 are caused by secondhand smoke. And this can be very concerning. Since the 1980s, teenage smoking has not declined. And according to the Illinois Public Health Department, teenage smokers can start before the age of 18, with an average age being 13 years old. Shortly, I'll be mentioning some risks, alternatives, and an unconventional solution to this problem. Now, health risks to smoking can be lung cancer, diabetes, heart diseases, strokes, etc. It can cause cell damage and an inflammation to the lungs. 10 to 20% of smokers develop lung cancer disease. Now, this may seem like a low number, but if you do the research, 87% of lung cancer deaths are contributed by smoking. Now, not only does it cause physical health problems, but also mental health consequences, such as developing anxiety, depression, or behavioral changes. There can be a decline in extroversion, a decline in openness, and a decline in consciousness. They're still doing research on this, but doctors do say that it may increase the risk of having schizophrenia. Alternatives to smoking can be e-cigarettes or vapes, which are the most common nowadays, but there's also chewing tobacco, hookah, which is inhaling flavored smoke from a tube connected to a pipe. There's also clove cigarettes, snuffs, which are cans or patches of tobacco you can smell or taste. And these are just a few options. The one major pro to these alternatives is that they can contain lower levels of nicotine. But that doesn't mean they can't still be harmful to the body. In some cases, it can be even more harmful than a normal tobacco cigarette. Now, you may have heard of hypnosis, either on TV, shows, just in the entertainment business. We see a person hypnotizing another to do something unwillingly, either out of ridicule or just plain entertainment. Now, hypnotherapy can be very helpful to quit smoking. How does it work? Well, hypnotherapy is a therapeutic technique that clinicians make suggestions to the person so it can help relax the mind and to help them focus on their goal. In this case, quitting smoking. David Spiegel, a psychologist in Stanford, says, when in a hypnotic state, the mind shifts into a different brain function. There is the Spiegel method, which is composed of 3 main points. Smoking is a poison, number 1. Now, the body is entitled to protection from smoke, number 2. And number 3 being, there are more opportunities to life as a non-smoker. The benefits of hypnotherapy can be addressing the problem of the addiction from the mind. It can also break negative thoughts and triggers, and clinicians may use suggestions as unpleasant outcomes to contribute to help quit smoking. Now they can say something like, whenever you smoke, you'll have a disgusting taste in your mouth, or that the smoke can trigger something negative. Hypnosis has been seen to be very effective, but also a less expensive therapy than nicotine replacement therapy. So that's a huge pro to it. Not only that, but also it can be combined with other methods. So you can either be taking hypnotherapy, and you can start by using replacements too, and eventually quit those replacements as well. Hypnotherapy is still to be more researched on, but like I said, it has been seen to be very effective amongst a lot of people.